This is a pulse oximeter or pulse ox. It has two AAA cells. This is the power button. So we have to place the finger in to get the readings of oxygen saturation. Where do you put the finger in? So you can see the red light flickering. So you should place the finger on top of the red light. Which finger would you use? So you should use the finger which fits in not too tight nor loose. Before placing the finger inside, you should make sure the fingers are clean and dry. There should be no nail polish, and it's always preferable to check it indoors. So I switch on. Right. And after you place the finger inside, you should hold it still till it displays the readings. You should check the SpO2 levels. Normal value is 95 to 100%. If it is below 95%, then contact your healthcare provider and they will guide you, as pulse oximeter can provide early warning signs of low oxygen levels. Thank you for watching. See you in the next video.